Hey everyone, my name is Caitlin. My nursing background, I have spent my nursing career at a level one trauma hospital in Massachusetts, UMass Memorial, on the accredited stroke unit. So I have a lot of experience with stroke patients, neurology patients. We do a lot of neurosurgeries, a lot of seizure inductions and EMU admissions. And then we also get some ortho trauma overflow. I also, about 2 years ago, started working part-time in the outpatient nursing life at an aesthetic medical spa. So there I see a lot of the weight loss medications. I see a lot of IV therapy, vitamin therapy, and injectables, um, the whole other side of nursing. So two completely different worlds. Um, in terms of pharmacology, on the stroke unit I work on, most of the patients have a ton of comorbidities. They don't just come there with a stroke, they often have multiple diseases that lead to them having that stroke. So the medication lists are large. Typically, like in a morning med pass, an average patient has like 10 to 12 medications. So I see a lot of the common medications used for common comorbidities in the population, which hopefully will help me in this course. Um, Also, in the outpatient job, I have called in scripts for our nurse practitioner many times. So I've had experience with kind of calling in a script on the outpatient side. And then we do like a pretty comprehensive med reconciliation when the patient first comes to the practice and have to be aware of some drugs that can have interactions with some of the procedures, such as light sensitizing drugs and the lasers, things like that. I have chosen the FNP track, and this I think is largely because of my nursing background. On the stroke floor, especially in Worcester, which is a city location, we see a lot of horrible, sad cases of young individuals or not even young individuals who have these very debilitating um, strokes that a lot of times might have been able to be prevented if they had the correct primary care and preventative care. A lot of people come into the hospital with absolutely no primary care or management of their comorbidities, uncontrolled diabetes, uncontrolled AFib, um, obesity, things like that, that are causing them to have these larger um, complications happening. So that was kind of one of the reasons that I was interested in primary care. And also, I just really like the preventative health side of things, um, in kind of taking a more holistic patient-centered approach. So two fun facts about I live in Massachusetts, so that's the state I'll be practicing is in Mass, NPs are granted full prescriptive authority. That is after completing a minimum of 2 years of supervised practice following their certification from a board recognized certifying body. During that 2 year period, the NPs must follow prescriptive practice guidelines that are in collaboration with a supervising healthcare professional. And then second, before you can prescribe these medications, NPs must also obtain authorization from the Massachusetts Board of Nursing as an APRN, and then also register for prescriptive authority separately by applying to the Massachusetts Controlled Substance Registration and a Federal Drug Enforcement Registration, or a DEA number. And then additionally, they are required to enroll in Massachusetts Prescription Monitoring Program and complete that required education that requires. So a few steps, but they are granted in the end full prescriptive authority.